Because I deal with the sickest cohort of heart failure patients, a lot of them will have issues relating to life and death. A lot of them will be experiencing end-of-life kind of issue that we need to discuss. And that's when palliative care becomes very important in my field of cardiology. Because heart failure itself is a very devastating disease, I think palliative care does make a difference to the patient's life, especially their quality of life. A lot of patients initially will reject us. They think we're giving up on them. So they say, oh, so there's no more treatment, you're giving up on me, no more surgery for me, no more coronary stenting, no more devices for me. That's not true. We always reassure patients that palliative care is about managing some of the symptoms they may have. Like for cardiology, especially heart failure, towards the end, the patient will be having a lot of dyspnea, shortness of breath. Some patients actually describe to us they're like drowning in their own lungs, So that is a very horrible feeling. So we are telling patients that there's no such thing as no treatment. Just because somebody doesn't have a cure doesn't mean that we can't do things to help relieve their suffering. I think the current model now is only when towards the very end, not uncommonly, towards the last few days or last couple of weeks of patient projected to be likely to die from the disease process, then we initiate the referral to palliative care. But I think it should be more upstream, just like preventive cardiology. So right from the start, when a patient had a very advanced disease, or even at an earlier stage of disease, we should already get palliative care in. In fact, I think palliative care is not just about dying, it's about supporting the patient throughout the whole journey of battling the disease. I think it's important in all fields of medicine. Most cardiologists are very hands-on. We like to fix things, whether changing a heart, put a new device in the heart, or putting some stent in a coronary vessel, or fixing the heart valve, all that. So when we don't get a fixed thing, usually cardiologists get a bit upset. Not everybody can come to terms with, I can't fix a patient. And when they can't fix a patient, some of them are literally, if I can use the word, at a loss. Where do I go next? By referring to palliative care, is that a declaration of I have failed in my duty as a cardiologist? We will need time to change our mindset. It should be something that all physicians, all healthcare workers, I think even our nursing colleague, allied health colleague, should be so-called familiar with. So I think we all need to be comfortable with it and can't just say that, oh, because I'm a cardiologist, I only deal with affair of the heart. If there is an issue in terms of death, let's leave it to the palliative care physician. Because at the end of the day, it is us, the cardiologists, who have a long-term relationship, a rapport with a patient over the years. So it's very weird towards the very last few days, last few weeks of the life of a patient, suddenly I say, I can't manage you, let's give you to somebody else who is called a palliative care physician when you've been with me for so many years.